Good afternoon. From midnight tonight, Jersey will enter Level 2 of our Safe Exit Framework, giving islanders and businesses increased freedom as we move safely and gradually towards the new normal of living with COVID-19. This is a hugely positive step, and one possible only because of the continued cooperation of all islanders in preventing the spread of coronavirus in our community. We currently have only 5 active cases of COVID-19 in the island. One of these cases was found through our planned workforce screening. 2 were found following the patients seeking healthcare, and the final 2 were contact traced because of their physical proximity to other cases. None of these cases involves a care home, and in fact the last case in an island care home was recorded on the 31st of March, some 10 weeks ago. Earlier this week, we also released detailed results of the second round of our community antibody testing programme, which suggests that about 4.2% of islanders, that's approximately 4,500 people, have come into contact with COVID-19. Of those who tested positive for antibodies, 62% had not experienced any symptoms. And all this testing has given us much more information about how COVID-19 has spread in Jersey, how it has impacted islanders, and supports our move to the next level of the Safe Exit Framework. So Level 2 is about being safer together, and I would ask that everyone, whether working in a business or as a member of the public, continues to follow the health guidance, meaning we can progress steadily toward Level 1 and the new normal. No one wants to return to Level 4. Increasing restrictions again will impact people's mental and physical health, their livelihoods, and our community. A phased relaxation of our measures is far better than a rapid return to a stricter lockdown. And together, we must achieve a balance of becoming more social, that's gathering a little more, taking part in more activities, and beginning some connectivity off island, without triggering an upsurge of new coronavirus infections. And as we all know, anyone can catch COVID-19 and anyone can spread it. But we can all reduce the risk of doing this by remembering the 4 safer principles which underpin our move to Level 2. And that's safer hygiene, safer at a distance, safer in smaller groups, and safer outside. Now in practice, this means please keep washing your hands, avoid touching your face, catch your cough or sneeze in a tissue or your elbow, and clean surfaces regularly. Keep a physical distance of 2 meters from anyone you don't live with, and continue keeping a smaller social circle than usual to help suppress a possible outbreak of COVID-19. And if you meet up for social gatherings and private sittings, such as parties or barbecues or informal get-togethers, these should be limited to a maximum of 20 people, and only if you have the space to allow for that number whilst maintaining distancing. The risk of transmitting COVID-19 is greater indoors, and especially over longer periods of time. There's less room to physically distance inside. So if you meet people or attend a gathering, you should do it outdoors where possible. Managing the risk of COVID-19 when you're at increased risk is not easy. So to support islanders to make informed decisions about their individual situations, further advice will be published next week. And once again, we're working with GPs and other healthcare professionals to disseminate the updated advice. If you are in doubt about your individual situation, please seek advice from your doctor or healthcare professional. And as we enter Level 2, we will also move away from categorising people as severely vulnerable and vulnerable. We're instead going to use high risk and moderate risk. And this will align with the new advice and support islanders to balance the risks of potential exposure to infection with the negative impacts of prolonged isolation on their mental health, mobility, and general fitness. And in light of the very low levels of COVID-19 activity in Jersey, if you are at moderate risk, you may return to work where it's been agreed with your employer that this can be done safely. However, at this stage of the pandemic, islanders should continue to work from home where possible. High-risk islanders can undertake outdoor leisure or recreation activities as long as they can physically distance from those they do not live with and follow other public health guidance such as regular hand washing. High-risk people should continue to undertake work from home where this is possible, and going out to work is currently not recommended unless, for example, they work alone and do not need to take public transport to travel to their workplace. So I'm now going to ask the Deputy Chief Minister, Senator Lyndon Farnham, to set out more detail on the business sectors that are able to operate with safety guidance in Level 2. And following that, we'll be asking the media for their questions. And for that part of the press conference, we are joined by Medical Director Patrick Armstrong. Lyndon.
Thank you, John, and good afternoon. Moving to Level 2 of our Safe Exit framework is an important step forward for our community. Nearly all businesses will be able to open, and islanders will have access to more of the services and freedoms they enjoyed before the pandemic. We are able to take this step because the medical advice tells us it is safe to do so. Of course, the well-being of islanders remains our overriding priority, and Level 2 will enable us to strike a balance between the necessary health precautions and providing more certainty for businesses and more opportunities for people to get back to work. To mitigate risk, there will be some new restrictions and guidelines for particular sectors. So from midnight tonight, Jersey will be open for staycations. Detailed guidance has been provided to allow our hotels, bed and breakfast, self-catering accommodation, Jersey heritage lets and campsites to welcome guests once again. And I would encourage islanders to take advantage of this opportunity, because not only will it provide a welcome rest and recuperation after lockdown, it will also be supporting our hospitality industry, which have been severely impacted by the pandemic. Restaurants and cafes will now be able to offer meals in their indoor as well as their outdoor seated food areas, with physical distancing measures, of course, still in place. Alcoholic drinks may be sold with meals, but an alcoholic drinks only service is not permitted at this stage. Dental practices will be able to resume routine care as well as urgent treatment. Counselling and mental health services and regulated allied healthcare professions, including chiropractors, physiotherapists, opticians and dietitians, can also open for business. In all these services, we are requesting that priority continues to be given to those most in need. People can visit their hairdressers, barbers, beauty and nail salons again. Piercing and tattoo parlours, laser and cosmetic clinics will also be able to reopen, provided they follow the strict guidelines to keep their customers and their staff safe. There will also be welcome options for leisure activities across the island, such as indoor venues as libraries, museums, galleries, cinemas, theatres and arcades can now open within their guidelines. The lockdown has highlighted the importance of sport and physical activity, so gyms will be able to open their doors once again. We are asking that indoor sports facilities are well ventilated and used for low to moderate intensity activities, owing to the risk of droplet spreading between people undertaking vigorous exercise in a confined space, even if they are well spaced. Higher intensity sports and fitness activities can be held outdoors, maintaining safe distance and following relevant guidelines. Indoor and outdoor swimming pools may open, but changing facilities are a high risk environment and should remain closed. So islanders are asked to come and play and go or swim and go. This may require some additional planning and preparation, but will allow access to these important facilities. Public playgrounds, paddling pools, outdoor gyms and similar may open, but you are strongly advised to clean equipment before and after use. All outdoor recreation may now open subject to the published guidelines, including, of course, cleaning between uses. Indoor businesses such as offices, warehouses, manufacturing and workshops are able to bring even more employees back into the workplace beyond those simply considered essential. We have also published updated guidance for work taking place outdoors and working in private homes. Cleaners, cooks, estate agents, internal building maintenance and home visits for hairdressing, for example, provided it can be done within the guidelines. All businesses will have completed or updated their COVID-19 risk assessments and ensured that appropriate measures are in place before opening. Where that activity takes place indoors, there will be greater requirements on businesses and the islanders who use them. You may notice changes that include being asked for your contact details so that businesses can keep a record for contact tracing purposes if necessary. You might also be asked to wear protective equipment such as a mask or be served from behind a screen. But these steps will help us to continue to move forward safely. So looking forward, the target for the move to level 1 is currently the end of the month or very early July, subject of course to careful monitoring of the health risks. We are also looking closely at reducing the physical distancing requirements from 2 metres to 1 metre. We all want to see the last few businesses in our economy open as soon as possible to help retain islanders' livelihoods and their jobs, and to start the island on the road to recovery. This can only happen, though, with your continued forbearance. And I would also like to thank those businesses opening from tomorrow for their fortitude and resilience and for the huge amount of help they have given to help enable government officials to produce all of the relevant guidelines on time for opening from tomorrow. Can I also pay tribute to all of the businesses and employees that have either remained working on the front line throughout the pandemic to date, such as food stores, and those other businesses that have been able to open at previous levels, with a special mention for all of our retailers, large and small, who have strived to provide access to their shops, their goods and services under the most difficult and challenging of circumstances. So please do take advantage of further opportunities and freedoms now available to us all under level 2. Please do celebrate all that our local economy has to offer, but please do so safely to ensure that we continue to move forward and positively and with confidence. Thank you.
Okay. Thanks, Lyndon. So throughout level 2, we'll continue to closely monitor the impact of easing restrictions on the spread of COVID-19, and the pace at which new measures are introduced will be based on the medical assessment of potential risks. And so if at any time our public health monitoring indicates a rapid increase in cases, especially those requiring hospital care, the easing of measures may be suspended. If absolutely necessary, a full lockdown could be reimposed. Now, there will be more changes as we move cautiously through the rest of level 2 and towards level 1, and islanders will see increased aspects of normal life returning. This will also be the last of our scheduled press conferences as we move into a more normal routine of public engagement. We'll continue to provide critical updates to islanders through the media, but these will happen as and when there are important announcements about our movements through the Safe Exit Framework. So I really do want to use this opportunity to say a sincere thank you to all islanders for your continued patience, support and cooperation during this crisis. You have demonstrated the spirit and sense of community for which our island is known, and have allowed us to progress so quickly to this good place. And to the media, thank you for your continued engagement, robust at times, but always with the aim of getting the public the information they need about how to stay safe. To the telecoms companies for promoting these press conferences, and to the technical team who've made them possible, thank you. Your assistance has been invaluable. To all the staff within the public sector, including in health and community services, the contact and tracing teams, in public health, in policy, in the ports, policing and communications, thank you. And a special personal thanks to the team I work with on a daily basis. You have all gone above and beyond to ensure the continued safety of our island, and we all owe you a great debt of gratitude for the work you've done over these last few months to tackle the spread of COVID-19. And now we're going to hand over to the media and to invite any questions you may have. So we'll follow the normal format of two questions each. And what we have Freddie Miller from the BBC, we have Harry Booth from Channel 103, Fiona Potney from Bailiwick Express, Island Jones from ITV Channel, and Johnny Drury from the JUP. Hopefully that's everybody there. Okay, Freddie.
Thank you, Chief Minister. The Deputy Chief Minister alluded just there to the target date for moving to level 1 remaining early July, as it says in the Safe Exit Framework. But can you confirm, Whisperings, that the target date for opening the borders is also early July? And in your answer, I'm hoping you can provide an update on the testing trial at the airport. How's it going? What are the challenges going to be when you look to scale that regime up?
I can't give you a full update yet on the testing regime. Essentially, this is the end of the second week, and so we're expecting that update basically early next week. Give them time to essentially write it up and get it to us. The challenge ahead will be making sure we can have that same robust level of testing, but being able to expand to essentially scale it up. If one is to try and go back to something resembling normal travel at some point. So in other words, at the moment, what we've been doing, which I think has been very good, it's been a very robust process in terms of the testing measures that they put in place. They're running a trial, obviously, on the very low numbers of people who are coming through. If travel does come back to a normal or something like a normal level, obviously you've got to make sure that you can deal with essentially many hundreds of people potentially coming through in a day rather than the quite low numbers that we're getting at the moment. And so that's probably the bigger challenge. But obviously on all of these things, the technology is changing all the time about what we can do, and the advice and the research is changing as well, which is what we follow. And in terms of specific timing, at this stage, I can't give you anything more specific other than I think we'd all like to get it done in a consistent point in early July, but I can't tell you an exact date as yet. And obviously, as soon as we get that information, that will be one of the more important announcements we need to put out, because again, that is about preparation and allowing people time to plan. Lyndon or Patrick, do you want to add anything to that?
Thank you, John. Well, I just really echo your views. It's a bit frustrating on timing, but of course the borders have been our greatest protection so far to the spread of the pandemic, or containing it, I should say. But I'm fully aware that many islanders want to get off island to visit friends and relatives and loved ones, and many people want to come here for the same reason. I'm also mindful of the severe challenges facing our hospitality sector, and so we must work to consider those and how they might be mitigated, of course, but I'm not condoning we open the borders before it is safe to do so, and I think in the short term we're going to be reliant on an increase, a ramping up in the testing as people arrive on island.
Patrick, do you want to comment on views of staff on the matter?
Yeah, absolutely. There are huge challenges in terms of testing at the borders. We've got to remember that our PCR tests have a false negative rate. People are coming to the island at a time when they may be negative, but then may become positive once they're on the island. And the scale of the testing that's going to be required is substantial. I think as important as testing within the airport at the port will be increasing our ability to contact trace and test on the island for people once they get here, and that's probably as much as a defence for us as whatever happens at the border.
Okay, second question.
Okay, thank you. But just to very quickly clarify something that you said there, Chief Minister, you said you can't give specific timing, but at this stage, you can't be more specific other than you'd like to get it done at a consistent point in early July. So can we say the borders could be opening at a point in early July?
I think on all of these, it's going to be subject to the medical advice we've got, which will take account of the robustness of the testing regime we have in place. And at this stage, I can't say anything more. Because some of that information will be coming through next week and the week after, which will then inform that decision. Patrick?
In terms of the advice that staff are likely to give, is it'll be like everything else. It won't be everything happening all at once. And I suspect from a practical point of view, that couldn't happen anyway. It's likely to be what we'd want to see is a gradual increase in numbers of people coming to the island.
Okay, I presume that was a supplementary on your second question.
It was indeed, just as in the States. As you've mentioned earlier, we know many people are going to probably be happy about the further relaxation of the restrictions, but we know, you know as well, there are some islanders who feel left behind. You have alluded to these in your statement right at the beginning there, Chief Minister. I'm talking about people afraid to leave their homes, members of the community considered particularly vulnerable to the virus. Now, I know you've said guidance is going to be published next week now. It was initially promised 2 weeks ago, incidentally, and that you're also no longer going to be referring to people as vulnerable or severely vulnerable, but high risk and moderate risk, as you've just announced. But can you tell us when next week this guidance is coming? And also, how can islanders find out which category they're in? Are they moderate or are they high risk?
I think the short answer in terms of when, next week. I can't tell you whether that's Monday or Wednesday or Friday, I'm afraid, but it is next week. I don't think we've ever said, well, I might be wrong. I don't think we've ever said 2 weeks, a week. I don't think we ever said 2 weeks ago. I think we've said in the forthcoming weeks, and what the anticipation might have been. It is
a week ago, you told me it would be within the coming days.
Which would still be in the context of next week. But we are now saying next week. And the difficulty on all of this is it's that balance between the risk that any one individual may face, the issues then I alluded to around physical fitness, around mental health and all those type of things, and almost if you like the personal responsibility side. So all one can keep saying, which is what I've said previously, one's really got to have a discussion with one's GP if one's particularly concerned, and I would suggest probably with the family as well. Patrick, do you want to add to that?
So this is an incredibly difficult area because you will never be able to categorise people into two groups. The risk is a continuum, and even if you take a single condition, so say you took asthma, for example, somebody may have asthma which requires an inhaler once or twice a year. Somebody may have hospital admissions 2 or 3 times a year, and the risk for that condition is very different for individuals. You've also got to throw into the mix personal choice and the amount of risk that people are prepared to take, and the effects it has on their lives. To be fair to the Chief Minister, and to those who are looking at it, which are our colleagues, I'm not involved in that. I know it's a very challenging area, but ultimately, I think all we can describe to people is the risk that they may face, and that will depend on how much virus is on the island, how many people are coming into the island, what's happening in the rest of the world, and people will then probably have to make up their own mind as to whether they want to take that risk or not, and we've got to respect every individual's wishes as to what they want to do.
And I think the point where we've got to today, and again, let's try and be positive on this front, the prevalence of the virus in the island and the transmission of the virus in the island is low. And therefore the risks relative to here compared to what you might be reading in other jurisdictions, even still, is low. But it's not zero. And that's always this balance on all these things. There's no such thing as a zero risk in this game, unfortunately. And that's probably the wrong word to use in this situation. But it is a balance of risk. It's been a balance of risk all the way through looking at the island public health. Harry.
Thank you very much indeed. First of all, many of these businesses that can reopen their doors from tomorrow, they've been planning for this day for quite a while now, trying to get everything in place that they think they need to have in place to be able to get going again. But the actual guidance for these businesses has only been issued recently. And for a lot of these places, that's affected what they think they could do. They've been planning to be able to do certain things for quite a while now, and all of a sudden, based on the guidance they've been receiving, they've second-guessed themselves. They think, oh, actually, I can't do certain things anymore, which they're finding quite frustrating. I think a few of them have been saying to me that they've been asking questions for weeks and not got anywhere, and this guidance has been issued quite late at the last minute, and now they can't do certain things. For example, beauticians, strong advice that they can't do close contact to faces, which to them is a big part of their work. What's your message to them in terms of why couldn't this guidance have been published any earlier to give them real kind of clear guidance on what they can and can't do? And what's your message to them in terms of their frustrations? This might affect what they can do, and they might not be able to open until later down the line now, which could affect them a lot with the fact that financially they've been struggling for a while.
I'll give you a brief overview, and then I'll hand over to Lyndon on a lot of the detail. So I think it's worth making the point. Firstly, we're really pleased that we've actually got to this stage, that we can allow these type of businesses to open. I think it's, again, just worth remembering, I think we're in week 13 now, which gives you an indication from when the first positive case came to when we're now able to go down. We've issued the framework, the Safe Exit Framework, and we're now down and announcing we're going to go to the penultimate level, if you like, to level 2. And so, we have been desperately keen to get these businesses in a position to open. They are not compelled to open at 1 minute past midnight tomorrow, if that makes sense, but we're really pleased that they're in a position that they can then, it's now under their control. What I will say, and it depends on the specific areas, but my understanding is that certain industry groups have been in consultation with the officers drafting the guidance, certainly last week. So although the formal guidance was only issued yesterday, certainly their industry representatives, shall we say, will have had a direction of travel, as I said, at the latest during the course of last week. And my understanding is that there were some discussions taking place earlier. But Lyndon, do you want to add to that?
Thank you, John. As I briefly alluded to in my opening statement, as John said, many of the industry sectors have been working very closely with officials over the last couple of weeks to make sure the guidelines are as workable and as pragmatic as possible for those industry sectors that are opening now. So we've actually pushed hard to get businesses open sooner than perhaps anticipated, on the back, of course, of medical advice. And I would rather see businesses opening tomorrow with the guidelines. The alternative was to perhaps delay it by a week and spend that week getting all the T's crossed and I's dotted of all the guidelines for all the industry sectors, but that wouldn't have been fair on those sectors that were ready to go. So all of the sectors that are opening tomorrow have guidelines. And there's no reason why those guidelines on the back of further medical advice can't be refined in the days and weeks ahead. My priority is to get these businesses open, to get the businesses and people back to work, and we've managed to achieve that sooner than was originally anticipated.
Okay, second question, Harry.
Yeah, sorry, can I just ask, like Freddie, a quick supplementary to the first, if I may? Sorry. Just for, I mentioned, gave the example of beauticians and close contact of faces. I think they feel a bit uncertain, a bit uneasy in terms of what exactly they can and can't do. What's your main advice to them in terms of they feel there's a bit of a grey area, they're not quite sure what they should do?
Yeah. So the guidelines there that treatments that involve close facial contact should be avoided, and that's the guidance. I don't think that should come as a surprise to anyone, given the way the pandemic, the COVID-19 is spread. So pretty much everything else can be done, but the advice is to avoid those close facial contact.
Okay, thank you. And my second question, I think something you briefly mentioned in your statement as well, Deputy Chief Minister, was looking closely at reducing the physical distancing requirement from 2 metres to 1. And I suppose that could make a huge difference to many businesses. 2 metres they'll find quite difficult to work by. Can you give us any more clarity on this in terms of when we could see this happen?
John? I can start if that's okay.
Yes,
fine. So I would like to see it sooner rather than later. We had a briefing this morning. The World Health Organization standard is 1 metre. I understand, and Patrick can confirm that sort of 80% of the droplets are contained within a metre range, and then in 2 metres is sort of a little bit. A smaller percentage is spread. So the vast majority of protection is in the 1 metre distancing period. So I'd like to see us go to that as soon as the medical advice suggests we do. And I know they're discussing that at STAC at the moment. It's really, really important for the logistics for businesses. I've said that our shops and restaurants and cafes, all of our local businesses, have done absolutely brilliantly introducing new systems to protect staff and customers. But of course, the sooner we can ease those restrictions and allow businesses to operate more normally, the sooner the recovery of the economy. Of course, bearing in mind we must not compromise people's safety. This has to go to the States with an order. There is a state sitting next week, and there's a state sitting 2 weeks after that. There's an opportunity to call a special state sitting in between the two, should the medical advice suggest we do that. And I would think if we do get that medical advice, we need to take that to the States quickly because of the severe impact still on businesses operating the 2 metre distances is happening. So, but if I may, I can hand over to Patrick, who might confirm my attempt at medical science.
Thank you, Lyndon. The further you are away from someone, then the less the risk. But we have to be realistic about measures that can be implemented and live with, and that's sustainable in the long term. And as always at STAC, we discuss the balance of harm. We have been discussing this week. And the view and advice that we will be putting forward is that we feel we should be moving to 1 metre. We provide advice and others interpret that advice and implement it. But our understanding, is, I think has been described as a legislative process that has to be gone through for that to be implemented. But I think we look around and we see that people aren't always adhering to that, and we'd rather give out advice that is practical and that people can comply with and also live with.
Okay, I think on all these, it's a phased approach, and so we're bringing level 2. Lots of things can start happening from 1 minute past midnight tonight, and then you keep bringing the other measures in that level 2 as and when, and on the basis of the advice that we receive. Okay, Fiona Bailiwick.
Thank you very much. Under the new draft guidance, cafes, restaurants and other businesses are being strongly encouraged to log all of their customers' contact details in a record of attendance to help with contact tracing. So can you explain why this burden is being passed to businesses instead of developing an app solution as has been previously discussed? Is this a cost-cutting measure, and what help is the government giving to businesses to assist with the bureaucratic and data protection hurdles that this process could throw up?
I'll let Lyndon go into the detail, but at the end of the day, as I understand matters, I think you've still got to make a reservation to go into the business, and on that basis, then you will have those details. But it also, we keep saying it's around. I mean, as Lyndon can correct me if I'm wrong there, but it is all about us as a community still working together. There are some issues around the contact tracing app, which hopefully will be resolved again in the next few weeks, to use that expression. But that is very much we've seen it in the UK, the arguments around whether you have a centralised database or not, which obviously at the moment would be our preference not to have one, and then seeing what the sort of likes of Google and Apple are producing. That's all in the mix. I think that's starting to coalesce down into a position, but we are not yet there. And that contact tracing app is quite important in terms of how you then start, again, beefing up the tracing measures that we've got in place. But as we've said previously, we already have a contact tracing team doing manual tracing of 55 people. And so then it comes down to, we can talk about the bureaucratic side of things. What we're trying to do is make it easier for businesses to open. And if, as part of that community responsibility, that's saying, can you keep a list of who your customers are that have come in, then that's part of the consequences of one of the approaches that we've had to take. Because essentially, in the event that you do find someone has had the virus or has got the virus and has gone into restaurant X for the sake of argument, we need to try and establish easily and quickly, from the contact tracing point of view, where that's gone. And that is one of, again, the whole contact tracing is one of the elements, not the only element, of having a really robust system over here to deal with COVID-19 going forward. Lyndon?
Thank you, John. And Fiona, I don't think this is a great burden for business. We're simply recommending that businesses, restaurants, take a name and a phone number. The track and trace element of how we've been containing the virus has been incredibly important to the success we've had in almost eliminating it locally. Most clients of restaurants are very happy to leave details because they make reservations and leave their phone details anyway. So we're just advising as a bit of a safety net that if there were to be a case in a restaurant, then we could quickly track and trace those that might have been in the vicinity to warn them so they can act accordingly.
And bearing in mind again, that is still a low rate, a low risk on the island. Second question.
If I might just, again, supplementaries all over I just want to clarify something there. We'd been contacted by a few businesses because there were concerns relating to how this would relate to data protection. There are certain rules when you're holding data for a third party. So obviously they wouldn't be holding this information in the same way as when they make a reservation. What they're actually doing is technically holding it on behalf of the government, just in case the government should have to call for that data for contact tracing purposes, which could throw up some kind of GDPR related issue. So is there a kind of legislation question there? Would an exception have to be made, or has this actually been thought through at all? I'd be grateful for your thoughts on that before I just ask my second question.
Lyndon.
Yes, it has been thought about. Restaurants do hold data, hotels hold data, and they're all registered with the data protection agency, and the data protection agency will be taking a very pragmatic approach to this use of data, given the unique benefit and the potential life-saving element of it should it need to be used. So I would like to reassure businesses there's no data protection issues for them by this simple process that we're recommending.
Thank you. Reassured to hear that. So we've been contacted by numerous islanders in recent weeks who've been using the Lifeline air routes, and some of them were quite alarmed to find the route rather packed without physical distancing in place. Can you tell us why the government didn't direct that physical distancing was maintained on planes? And will ferry providers be directed to ensure distancing when they're able to start operating again? And if I might add a supplementary on that, it would be helpful to know, will a testing programme be in place at the ports also when they begin operating? Thank you.
Okay, whilst Lyndon's gathering his thoughts on the first part, as he has responsibility for ports, I'll just assist slightly on the second part, which is however one comes into the island, there will have to be a testing regime of some measure. And one of the challenges actually between the airport and the port is if you have a boat coming in with, or a ship coming in with, say, 800 passengers on it, that's a different logistical exercise of let's say 800 people all turning up in one go versus perhaps 5 or 6 planes coming through with 100, 150 people on it, say, spaced out. And so the logistical element, the practical element, is actually one of the challenges that people are now trying to go through, and that's why one's trying to get the pilot sorted out at the airport first, work out those logistics. But I do know there have been some discussions at official level, at officer level, during the course of this week as trying to work out how they deal that challenge. They haven't come back to either me or Lyndon yet with what their solution is going to be, but I do know they're working on it. Lyndon.
Yes, just to endorse what John said, I'm very keen for a testing regime to come into operation at the ports. I think as soon as possible, I'd like the opportunity for islanders to be able to get off the island onto the continent. A lot of islanders have homes there as France begins to relax its travel regulations. And many islanders need to go over there and look after their interests, and I would very much hope we're in a position to offer that facility at the ports on a scale that makes it logistically possible as soon as we possibly can.
Do you want to address the first part? Oh, yes.
I'm not going to address the first part because much as I'd love to be on one of those planes, I haven't been. What I was going to say is we will have the advantage over coming weeks that we can look at other jurisdictions. So a lot of other jurisdictions are opening up, particularly in the Far East. and they've all got different regimes, so we'll be able to learn from them exactly the effect that different approaches have, and we're certainly the information coming into Stack will help us inform and advise. So I think it'll be an iterative process, and we'll be able to learn from other people.
In relation to distancing, on planes, actually, myself and my fellow States members had a briefing this morning from officers, and Dr. Muscat actually touched on this point, because the question was asked quite rightly: should somebody arrive in the island and test positive, then what is the track and trace process from that period? And of course, on aircraft, it's considered, I think, if you're sitting in a row, those sitting next to you or in adjacent rows either side would be tracked and traced. So that's the industry standard and the global acceptance of the process in relation to that.
Okay, right.
There's no distancing, then that's not a government stipulation that there has to be distancing on a plane then?
No, I mean there are instances where you have to be realistic and pragmatic, and there are instances where you can't keep 2 metre distance. It would be absolutely impossible. So there has to be a sensible view taken on that, and we see it now as we walk around the island and passing somebody in the street or on a walk or something like that. You have to momentarily pass within the 2 metre distance. Patrick alluded to it as well when we were talking about the position, the timing of going to 1 metre on the back of sound medical advice, which actually is a more realistic position to be in and more attainable for islanders.
I think probably we should also just emphasise that for medical flights, as I understand matters, there is very strict distancing taking place on there, which is different to the more public flights. Okay, ITV.
Hello.
Hi.
I'd like to return to the guidance that's been published for businesses. Obviously, we've heard the same. A lot of businesses feel that the guidance has been published very late in the day. Ultimately, though, it's guidance. There seems to be an element of discretion available to business owners when it comes to reopening and how they individually do reopen. Yet they're also asked to have risk assessments ready for potential inspections. What are the checks and balances which will be in place to check that businesses are operating safely?
Lyndon, do you want to kick off on that one?
So it's pretty much a continuation of what we've been doing from level 4 to level 3 to level 2. We've had, I think, a very well balanced approach by the States and Honorary Police, who are, I think, policing it very pragmatically. And of course, we have rules in place in relation to safe distancing. Now, it can be a criminal offence in a public place to not to obey the instruction of an officer if you're not spatially distancing. So there is a safety net there or backdrop for the protection of islanders and their staff. But businesses and islanders continue, in the most part, to act responsibly, and we keep our full confidence in the police and honorary police to continue to policing it and monitoring it as they have been doing.
I think it's probably just worth reiterating the point, as we've said earlier, that certain business sectors definitely had input, I believe last week, as the guidance was being developed. So although the formal publication only took place this week, they should have been aware of the direction of travel in advance. And as we've said, partly, in a way, the good news, but one of the challenges that comes out that good news is that we are, as I've said, 13 weeks into this. So we've gone through a whole gamut of things. So this is why all of this is being developed at pace. Okay, your second question.
Thank you. We also obviously get questions about people desperate to see loved ones in care homes. How do care homes and people in care homes fit into your recategorisation of the risk groups?
Patrick, do you want to cover on that side?
I think this will come through the work that has been alluded to and the advice coming through next week. And yeah, I mean, absolutely, people need to see their loved ones. So I think that advice is being developed. But again, it is guidance and it is advice, and there's got to be space for personal choice, and it may well depend on the overall health of the individuals, but also we see in health there are some people who just want to get on and get on with their lives, and other people who are much more nervous. So it will depend on that individual's choice, really, I think, ultimately.
I think it's worth, again, reiterating, obviously care homes, as we know, is again, one of the more risky areas, unfortunately. And again, I think you should be hopefully acknowledging the positive on that. So as a guide, I think we've got around 1,000 beds in care homes on the island. And in total, I think we've had 35 care home residents who have tested positive out of that number, which is, and part of that is from the very good work that was done, which was getting the GPs in place, getting the right systems in place very early on. And so the fact we haven't had a positive case in there since I think it was 31st of March, is something we really do need to acknowledge that a good piece of work was done there. And obviously that's, again, it goes back to this whole thing about balance of risk, and then into, let's call it the mental health, quality of life aspect, which is around, contact with people. Right, Johnny, JP.
Afternoon, Ministers. Afternoon, Dr. Armstrong. Chief Minister, in your statement just earlier, you mentioned that your regular press briefings are going to be stopping. Just a couple of points on that. Also in that speech, you said to people that this is far from over. But it comes across as a bit contradictory that these briefings will end. I know there's a lot of people out there who listen to these briefings regularly. They use them to help themselves, to find out information, and they're reassuring to a lot of people, even though some of them might not add a lot of detail. So I wanted to know whose decision it was to end these regular briefings that people, find so helpful. And by ending them, is that the government avoiding a little bit of scrutiny, or is there another reason for it?
No, what we've said is that, we can always take the public feedback, but the general view was that we are now getting to the point after in level 2 that we are down to a relatively, hopefully, low level of change, if that makes sense. And what we said is we'd do a press conference as and when there was an important change to announce. Now, if the view is from Islanders that actually they want us to keep doing them, I'm sure we'll respond accordingly. But it was whether this particular type of format worked from the perspective of a regular weekly update, without necessarily having any new information to give. And what that meant was going back to the kind of slightly more normal. And at some point, I think that means you guys can then be addressing us face to face rather than down a screen and things like that. So moving out of this format, but on a kind of as and when basis, that we've got new things to announce, rather than sort of a weekly just saying, well, actually, there's no change to the previous week. I think the other point in that lot is trying to make sure that we do want to keep the kind of public engagement level up, and so we've got to explore some other areas where we do that, whether that, for example, includes, but it does depend on the dynamics you're trying to address. So also I did do a session on Twitter quite some time ago, whether we did another one or equivalents, and find some different ways of getting that public engagement through. Certainly to date, we've, in terms of your scrutiny aspect, we've kept until the end of September for all the state sittings. There's an hour of questions about notice to all ministers by all members, which is a significant increase on the old position. And obviously, no doubt, you'll be coming through to us with your normal press queries. But it was really to signal that we will be going to what I think we would call a more normal level of public engagement, rather than the kind of every week, possibly doing this format. We will see how we go. I know other jurisdictions equally are slowing this side of things down as we move out of, shall we say, crisis situation to kind of navigating our way back to a more normal position.
That's great. Thanks very much.
Okay.
My second question, also to yourself, Chief Minister. Sorry to single you out.
It's okay.
You mentioned, obviously, at the start of this crisis, your strategy was delay, contain, shield. That's slightly changed now to suppress. That was at a time where I'm guessing no one, even the doctors, didn't know how big this was going to grow, which was evident by the building of the new hospital. Now that you've had that degree of success and we're down to 5 cases, how do you personally review your government's overall response? Did you expect to get to this low stage so soon, or were there times where people at the top were worried that this could spiral out of control?
I think we've done brilliantly at the end of the day, to date. Always add that element of caution, because although I've said we are heading towards, hopefully, we're navigating our way out of it, we know there are steps that go through, and we know there are going to be challenges as we progress further. But to date, I think we've done brilliantly, and that's thanks to the team, ultimately the team I lead, but and that goes all the way down through the public sector to everybody who's been doing their bit on giving us either the right support or the right advice to make the decisions we've made. Did we have points in the early days when we had difficult decisions to make? Absolutely. Didn't have perfect information? Yes, absolutely. And I think to date, as we've said, we've ended up in a very, very good place. If we use things like the Nightingale as an example, that was a decision that was made. It was made swiftly. It is still an insurance policy, and like any insurance policy, you want it there, but you hope you never use it. And that's been some of the stances we've had to take. It's been the balance of risk and the balance of probability in an uncertain world, and particularly as research has changed and therefore medical advice has changed. And it's always been done on the best medical advice we've had.
John, can I just adding to that, and so I can endorse the Chief Minister's comments. I think that the government and the states have done okay, the best they possibly can, and we're still learning all the time. But I just wanted to say that the success has been possible because of the forbearance and fortitude of islanders and businesses. I think that's the important point to make. So our success is their success, and I thank them for it. Thank you.
Absolutely. Again, you can lead a team, but you can't do it without the support of all the people behind you as well. So absolutely, in terms of Lyndon, we've said it so many times, the Islanders community, etc., have also been fantastic in following the advice we've been giving.
Just to supplement that with Dr. Armstrong, sorry if you were going to speak there, Dr. Armstrong. I know that the sort of the medical advice comes from yourself and Dr. Muscat, Dr. Turnbull, and people who work at the top. I know hindsight's a wonderful thing looking back. Was there a time early on where even at a medical level you were concerned that this could spiral?
Absolutely. And when we were seeing the images coming out of Italy, and we've seen what's happened in New York, and we've seen what's happened in other countries around the world, that was our number one concern, is that it would spiral out of control. And we're just, I think we're all very grateful that it hasn't, and the measures that have been put in place have got us to this position. But we have to remember we are not out of this. We still have active cases on the island, albeit very few. There's a huge amount that we just don't know about this virus and how it's going to behave. Most respiratory viruses do naturally reduce over the summer, and they do naturally increase over the winter. So nobody knows what's going to happen next with this. So I think the approach of gradually and slowly coming out, because the measures have been painful for everybody and continue to be, and what we don't want to do is have to suddenly go back if we see a significant upturn in cases. So I think the slow, gradual approach is the right one, and I'll say it again, the biggest risk that we have moving forward is what happens when we start opening our borders, and what is happening in the rest of the world. So we're going to have to watch it very carefully.
So looking ahead, obviously we have a number of things going on in parallel. We have coming out of where we are now, and exactly as Patrick has alluded to, and that's about continuing to support islanders, is continuing to support those at risk, but it's also continuing to balance the overall well-being of the island. It then goes into the supporting the businesses and the islanders through our co-funding payroll things and all those sort of measures that we've had in place. Is then looking ahead to what is going to be the economic impact going forward, and those discussions are obviously happening, and that will then feed into what we've got to then statutorily do, but also in practical terms do towards the end of this year in terms of government plan and budget and preparing for next year. And at the same time, and we have already directed officers to be, and they didn't need any direction, they were already doing it, about planning about what happens in September, October, November. And that's about making sure that hopefully the measures continue to work as we've done. But being that cautionary thing, Patrick's said it now, we've all said it in previous press briefings about what does happen in the winter months, and making sure then that we are just keeping an eye on that and making any preparations that we need to do, again, as the research comes through and as the advice changes.
That's
John,
great. Thank you very much.
May I just go back one? I just wanted to comment on the message in relating to the continuation of the media briefings and stress that the format is likely to change, but also stress that strong communication from government will continue. The work that I'm going to be leading with the Chief Minister on economic recovery as well is very, very important, and we will be continuing with that work to give regular briefings and strong communications. So it's really, I just want to make sure that wasn't misunderstood, and it's the format we're looking that's enabled that we'll be able to progress with that as the need for physical distancing reduces. John, I hope you didn't mind me just adding that.
No, it's fine. Mm-hmm. Okay, it is 2 minutes to 3. Ordinarily, we should be stopping here. I mean, I might get a groan from one or two directions. Do we want to try and do one very quick question each? Fine, but it has to be very, very short questions. You might even get a short answer. So, Freddie.
Okay, I'll try and keep it brief then. One of the key concerns people have told us, and particularly people who are shielding, is that they don't know where new cases are coming from. Now, in your speech right at the beginning, you did talk about the 5 cases we have at the moment. But as you're not going to be having press conferences anymore, will you commit to making that information available online so people can see where these cases are coming from?
I can even tell you when we're going to start issuing that, because that's being updated tomorrow. In fact, it might even be coming out this afternoon if we're lucky. So, and that will give you a breakdown between active cases, symptomatic and asymptomatic. Give you a very overarching view of the locations, and it will also probably identify how we've identified where those cases have come from. So, for example, is it because somebody had symptoms and went to seek some healthcare advice, or was it through contact tracing? Those type of things. There's 5 categories in there.
Yeah, thank you. Sorry, just to labour the point, I don't think we have said we're not going to have any more media conferences. I think we said we are, but we could possibly change the format. So that I want to make that absolutely clear.
Okay, Harry.
Thank you. Deputy Chief Minister, you mentioned in your statement about indoor businesses, offices, warehouses, workshops, etc. can bring more employees back, moving to level 2. Is the advice for people, if they can work from home, they should continue to do so? And will they be affected by a move to 1 metre physical distancing? Will that still be the case then?
I think, should I take that? Yes, that's still the very best advice, where you can work from home. Please continue to do so. But under level 2, officers can accept more staff, those considered to be a non-essential, but they must observe the physical distancing guidelines. And I think that would be particularly useful for some, especially for some of the very large offices we have that have plenty of room to accommodate more of their staff on site with the correct procedures in place.
But the summary is that the preference or the advice to continue to work at home does remain. Okay, Fiona.
Thank you. We know that individuals of certain ethnicities are more likely to suffer severe symptoms or even die of coronavirus, in particular Black and Asian people. Has the government collected any data in relation to the ethnic background of people who have had coronavirus to inform its shield part of its strategy? And if not, why is that?
Patrick.
Just check that I heard your question right. For the people who've actually suffered from coronavirus, I'm not sure the answer to that. What I do know, certainly I can speak for Health and Community Services, we have surveyed our workforce and getting a breakdown of ethnicity so we can understand it further. But no, I'd have to get back to you on whether that other piece of work that you alluded to has been done.
So we have part of the information. We're not necessarily clear whether we've got the entire... do you mean across the island, by the way?
Well, all of the cases that have been logged, all of the positive cases that have been identified, has any data been collected about the ethnic backgrounds of those individuals?
We'll come back to you on that one, because I know we have obviously age ranges, we have gender, and we have and obviously where those a breakdown of where those people were located, shall we say, in other words, whether it was in the community or whether it was in a care home. Have they included, in terms of some of the information we receive, it has always been the case around respecting privacy. So because of the low, sorry about that, it's an age-old thing. So if there were a very low number of people of a particular ethnic background were identified as having had the having had the virus, we may not be told about it from the point of view of keeping that privacy together, but it may well be that we have the data. So we'll go back and find out what the situation is. If there's a potential risk of an individual being capable of being identified, we go back into that problem we were having at the very beginning. Is that fair?
Yes, that's fine.
Yeah. Okay. ITV, Islam.
Sorry. Going back to the 5 active cases, you've obviously provided some detail on those cases. We've heard lots of different things, obviously, as well about these cases. Suggestions that one is that they've emanated from one central location, the other being that they're all concentrated in one household. Are you able to give any detail or assurance on how contained these cases are?
Can I can give some stats and I can hand over to Patrick. So the statistics I've got at the moment are that 4 are symptomatic, 1 was asymptomatic, 1 location-wise, 1 is in the hospital and 4 in the community. And the way they were identified, 2 were because they were seeking healthcare advice, i.e. because of symptoms. 1 was a planned screening exercise, and 2 was through contact tracing. Patrick, do you want to add anything else on that? But we are, again, because again we're in that low number territory, we've been trying to be careful about what information we can give out without, again, trying to labour that point, without actually breaching privacy issues.
No, I can assure you that every case is looked into. That team is led by my colleague Ivan Muscat, and we get presented at STAC detailed information about every case that we have and where it may have come from. And yeah, the contact tracing is being done very thoroughly.
Okay, final question, JP.
Thanks very much. This one's for Senator Farnham on the topic of business. With us moving to the second phase now, or phase 2, the majority of businesses now, I imagine, will have their doors back open and will be trading, probably a lot of them at reduced levels. What will that mean for the financial assistance the government has provided for businesses? Is now the time where your officers are looking to reel that back in, or are you still?
Thank you. That's a good question. We're not looking to reel that back in just yet. We've committed to extending the support till the end of August. Of course, we are now in discussions about what the support might look like after the end of August. I suspect there will be changes. We could look at changes to the payroll system, but there will be no cliff edge. We're not going to suddenly stop support. It might mean we have to offer more support to certain businesses that have been slower to recover, less support to businesses that are showing almost signs of a full recovery. But the commitment that the Chief Minister and the Treasury Minister and myself have made previously stands. We're going to continue to provide support, good, strong support to business to protect jobs into the pandemic and out of the other end into the economic recovery.
Thanks a lot.
Okay, thank you very much. So what I'll just do, just to sort of wrap up for today, is just to thank everyone for tuning in. This was actually our 27th press conference, with yesterday marking about 3 months since the first reported case of COVID-19 in Jersey. And at times we've had up to 28,000 islanders watching on government social media, with more listening on local radio and via other channels. So thank you all for your continued attention and engagement as we've navigated the pandemic to today. Now, whilst we're reducing our regular press conferences, I emphasise, we are going to be looking at ways to continue communicating critical messages of islanders, including those who might not use social media or the internet. And as we move through level 2 and toward level 1, we'll be putting an increased focus on island recovery. That's both economic and social, and that's to ensure we come out of this crisis as a strong, successful and cohesive community. And on just a note to finish on a personal note actually, and completely nothing to do with directly with the crisis that we've been navigating through, although for many people who've been taking exercise during the course of the island, they may have noted, and they've noted the area I'm going to be talking about. On Saturday, it marks the 20th anniversary of when we opened the Millennium Footpath in Waterworks Valley. And that was a somewhat younger John Lafondre was project manager to bring that project to fruition. And actually it was a fantastic experience and something I certainly remain hugely proud of. So I'd just like to kind of mark that day. And we had around 60 volunteers, some of whom sadly are no longer with us. But we all came together over several years to bring that project to completion, and many friendships were made. And at the time, I said for me, it was an example, a brilliant example, an excellent example of the community spirit that existed in Jersey, and I remain very much of that view. And so I just want to express my thanks to friends and parishioners of St Lawrence for all of their support that allowed us together to build something that's been enjoyed by hundreds of islanders ever since. So if you're walking up Waterworks Valley this weekend, have a look at what was done by 60 plus volunteers some 20 years ago to allow you to enjoy that valley to the date you do it now. So on that note, thank you very much. We'll bring that press conference to a close.